Hello and welcome to the 70th Bi-Monthly Breastfeeding Coalition's webinar. Oops, let me share my screen. Welcome to the 70th Bi-Monthly Breastfeeding Coalition's webinar. I'm Kinkini Banerjee, the Coalition Relations Director at USBC, and I'm so glad to welcome you to this session. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity and by the USBC. And the webinars known as the 222 are held on the second Tuesday of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of this series is to bring together practitioners and advocates from the field of maternal and child health to share best practices and news, and to network and collaborate on issues of national significance. We alternate the sessions, so we highlight the work of state, cultural, and local coalitions one month, and then a national or international organization the next. These webinars are free, and access is open to anyone interested in the field of breastfeeding and MCH. Once you register for a session, you are set. To get our announcements, you can join the Coalition's Learning Connection. And if you haven't already done so, it takes just a few seconds. You need a user account and to set it up, and the topic and speaker details are posted. The details are also posted on our public-facing page at usbreastfeeding.org/coalitions-webinars. Like I said, that these webinars are set as a series, so you just need to register once, and you will automatically get reminders the day before, the week before, the day before, and an hour before each session with the topic and speaker details. And we recognize that this is in the middle of the day and that not everybody is able to take time off their works to attend the sessions live. So we record and archive them on the webinar page as well. So you can come back and listen to it again and again, or if you've missed the live, you can come back and access the recordings at your convenience. Again, to find the archives of our past sessions, you can go to our webinar page. And if you go to our website, you'll www.usbreastfeeding.org, you'll see all the tabs across the top. The last tab is the one called Coalitions. Click on it and it will open up a drop-down menu, and choose the CDC-USBC bi-monthly webinars, and that will open up. Our operations manager, Danae, has put the link in the chat box for you to access the handouts for today's, the presentation for today's webinar. So you can click on it and it'll take you directly to this page. For our session today, since all attendees are in listen-only mode, we want this to be as interactive as possible, despite the virtual format. So please share your insights, comments, and questions throughout the presentation. You can type your questions as they come to you during the session. So here's how you do it. On the right of your screen, you should see a webinar control panel. If you don't see it, it might be minimized. So click on that orange tab with the white arrow and it'll pop back out. And when you scroll down to the tab under the audio, it says questions, and click on that questions tab and it'll open up a box for you to type in. And then during this session, if you have any tech issues, audio problems or other problems, please either chat us in the box or email coalitions@usbreastfeeding.org, and our staff will do their best to help you. And that brings me to today's session, the first 1,000 days, Nourishing Healthier Futures. The critical time between pregnancy and age 2 provides the foundation for lifelong health and development of both children and societies. In the work that we do in our sphere of maternal and child health, we recognize that if we want thriving, healthy, and resilient communities, then we need to collaborate, coordinate, and tirelessly advocate to ensure equitable beginnings for all children, no matter where they live. The USBC is so excited to highlight the work of 1,000 Days, a Washington, D.C.-based advocacy organization. 1000 Days mobilizes parents, thought leaders, policymakers, and its vast network of partners to make the nutrition of women and children during this critical 1000-day window a funding and policy priority. Guided by the science showing the foundational importance of good nutrition early in life and the conviction that all children deserve a chance to reach their full potential, 1000 Days advocates on a range of issues in the United States, including paid family leave, the supplemental nutrition women, infants, and children, the WIC program, as well as protecting access to comprehensive, affordable health care. During today's session, we will hear how 1000 Days works to promote, protect, and strengthen breastfeeding policies, programs, and practices in the US and across the world. And we will also learn about the upcoming Global Breastfeeding Webinar Series 2018, a free training that's being offered to advocates across the world on how to utilize social media to promote, protect, and support breastfeeding in the lead up to World Breastfeeding Week, and in the US, the National Breastfeeding Month in August. And I am delighted to introduce our presenter for today. Lucy Sullivan, Martinez Sullivan, is one of the founders of 1000 Days and serves as its executive director. At 1000 Days, Lucy leads a team of fierce advocates working on behalf of women and children in the US and throughout the world. Prior to starting 1000 Days, Lucy worked as the executive director at CCS, a management consulting firm that provides counsel to nonprofit institutions on issues of strategy and philanthropy. Lucy has, brings a real depth of experience working with the Bill and Melinda Gates Foundation. Her clients included the Bill and Melinda Gates Foundation, the Wildlife Conservation Society, Action Against Hunger, and the UN Foundation. And Lucy, in addition to all her advocacy work, also brings very extensive marketing and brand management experience. She holds a master's in business administration from the Wharton School of Business at UPenn and a Bachelor of Arts in Political Science from the University of Florida. Lucy and her husband and their 2 young daughters live in Washington, D.C., and she's turned her professional passion for maternal and young child nutrition into a personal one as well. And we are so thrilled you're with us today, Lucy, to share the transformational work of 1000 Days. So I'm going to turn it over to you now.
Thank you so much. Thanks for that kind introduction. I hope I can live up to it during this presentation. And thanks to everybody who joined today. Hopefully you all can see me. I'm going to try this out, doing a webinar with my face on the screen. I hope it makes it a little bit more personal and interesting, and you all can feel as though we're having a conversation and a discussion. So I really look forward to the questions that you all might have today. And some of you may be very familiar with our work. Some of you may have no idea who we are, and everything in between. So I'm going to try to tailor this presentation and my talk today to kind of a wide array of perspectives, perhaps. And just in terms of kicking off, I think the introduction that was just given, I think gave a nice overview of sort of who we are and what we do. But our work very much is guided by this notion that every child, regardless of where they're born, whether they're born in India or Indiana, really does have a right to good nutrition, and we work to make sure that they have a healthy first 1000 days. The origin of 1000 Days actually started, we started as a global advocacy partnership. In fact, we were started out of the State Department under the leadership of then Secretary of State Hillary Clinton, who recognized that maternal and child malnutrition was this forgotten issue, and at the time used her platform as Secretary of State to highlight the science around that had shown the critical importance, the foundational importance of a child's first 1000 days, starting during a woman's pregnancy, and how what happens in that first 1000 days, the quality of that child's nutrition really does set the foundation for health and prosperity and really global development. So the last several years since since those beginnings have been a journey for us here at 1,000 Days. We've had the great privilege of working with some of the world's most prestigious and best known institutions and funders and resources. So we've really stood on the shoulders of many, many giants as part of our work. Our main mission really at 1,000 Days is to promote action and investment in nutrition during these first 1,000 days. And a big part of that is making the case for why the first 1,000 days matter. And when we think about the first 1,000 days, we think about both mom and baby together, that the health and well-being of mothers is inextricably linked with the health and well-being of their children, and therefore the health and well-being of families, communities, and really entire countries. So that's very much the view that we take. We make the case for why the first 1,000 days matter and why nutrition specifically in the first 1,000 days matter in 3 ways. First, we see it as a foundation for brain development and learning. Much of the human brain is built very early on in life, and brain connections are really formed and strengthened during those first 1,000 days. And if you think about all the incredible growth and development that's happening in a young child's brain, what is actually fueling that, especially early on, is nutrition, is the food that the mother eats when she's pregnant, the food that a baby is given through breast milk, primarily, or obviously through formula as well, and then the food that the child eats when they start complementary feeding. And the brain begins to develop very early on in pregnancy. And so when we hear colleagues talk about early childhood development, we always like to remind everyone that brain development, early childhood development, actually starts with mom, and it starts during her pregnancy. And a mother's diet really before, during, and during pregnancy is critical. It provides all the nutrients that a child gets to fuel that incredible brain growth and development that's happening in utero. And then, of course, once the child is born, breast milk is really the ultimate superfood, empowering all that brain development that's happening. Breast milk is unique. It's really unparalleled in its ability to help a child's brain develop properly. As many of us know, infant formula manufacturers have been trying to mimic breast milk and replicate it unsuccessfully, in part because they recognize how powerful breast milk is. And of course, it's not just the actual milk itself. The act of breastfeeding also fuels brain development. It's really important that nurturing and that interaction between mom and baby during breastfeeding is a really powerful agent for brain development. And then, of course, when babies start to eat complementary foods and into early childhood, the nutrients, a nutrient-rich diet is incredibly important for helping a baby's brain grow. I think the one fact that really has resonated with a lot of policymakers when we're trying to make the case for why they should be thinking about prioritizing maternal, infant, and young child nutrition is the fact that the 1,000-day window of opportunity is a short window to make a lasting impact. And when we don't get it right, the consequences are devastating, and in many cases, they're irreversible. A lack of good nutrition, and specifically a lack of key nutrients that are needed for brain development at very sensitive periods during that first 1,000 days can have a lasting impact and really can put children on a trajectory to developmental difficulties, trouble with school, and then lower earnings as an adult. Good nutrition in the first 1,000 days also lays the foundation for lifelong health. And there's a growing body of evidence that shows that a person's health later in life, including their predisposition to obesity, diabetes, heart disease, other diseases, is really shaped by how well he or she is nourished during those early years, as well as by other experiences. And what's interesting is that there's emerging research that also indicates the effect of poor nutrition, not just having an impact on a child's health, but also on that the child's offspring health. So there's a multi-generational effect When we don't get it right, when we don't get good nutrition in the first 1,000 days, the effects can cascade through generations. Pregnancy, here again, is another critical period when a mom's health or eating habits have a huge effect on a child's metabolism, their immune system, their organ functioning. And the most important factors really are the quality of a mom's diet during pregnancy, the rate at which she gains weight, and then her own health and lifestyle habits in terms of shaping the health outcomes for the offspring. Infancy, also another critical period, and that's really when babies start to learn how to eat and form taste preferences. Actually, taste preferences start to form in utero, but really in infancy, the child's palate is trained, and that's where lifelong eating habits start to form. And the consequences of a poor diet and eating habits during early childhood, of course, are pretty significant, as I think this slide shows. Rapid weight gain, for example, in the first 2 years can really set a child on a course of obesity later in life, and of course negative health outcomes later in life. And that trajectory is one we want to try to change. And then finally, we talk about the first 1,000 days, the foundation for more equitable beginnings. There are three, the Harvard Center on the Developing Child has identified 3 foundations for what makes a child develop in a healthy way. Stable, nurturing caregiving is one, safe, supportive physical environments is another, and then appropriate nutrition is a third. And that third pillar is what we at 1,000 Days are very much focused on. We know that there are tremendous barriers globally and in the US, socioeconomic barriers to good health and nutrition, and that contributes to unequal starts for children. So we want to make sure that children everywhere get a fair start to life, because we know that once those trajectories begin early in life, in terms of growth faltering or developmental delays, and as a result of poor nutrition or other things, those effects can last a lifetime. So the best time to prevent these inequalities from cementing and getting settled in is, of course, in the first 1,000 days. And this, we'll see this and talk a little bit more about this later on when we talk about sort of the US context. So overall, what a child needs during his or her first 1,000 days is the same, regardless of where they're born, regardless of whether they're born here in the United States, in Kentucky, or in a rural village in Kenya, because the science is clear on what kids need in the first 1,000 days in order to grow and learn and thrive. And we've sort of built these 10 building blocks for a healthy first 1,000 days, drawing on recommendations from the scientific literature from the World Health Organization, WHO, the American Academy of Pediatrics, etc. And all of these building blocks are critical for a child's healthy growth and development. So we really think about sort of the 1,000 days as a universal opportunity, a universal window opportunity. And we also look at the problem of malnutrition as a truly global issue. It's an issue increasingly without borders. The global statistics here on the left paint a picture of a world that, if you look at the numbers, really indicates a vast scale of a problem of malnutrition, whether that malnutrition is defined as undernutrition, meaning not enough nutrients and calories, which can lead to stunted growth, which 1 in 4 children under the age of 5 experiences throughout the world, or malnutrition takes the face often of obesity or overweight. And we are seeing a rising epidemic in low and middle income countries throughout the world of overweight and obesity. Over 41 million children right now under the age of 5 are considered overweight, and this number unfortunately shows no sign of abating. And then when we think about the nutrition of women and girls, and in many parts of the developing world, it's girls that are actually are the mothers of today. We see that there's over 1 billion women and girls that don't have the nutrition they need to thrive for themselves, and of course, if they choose to become mothers later on. In the U.S., the picture looks a little bit different, but not that much different, unfortunately. We have high levels of food insecurity. We're all aware of the statistics around obesity, particularly early in life, and how those statistics play out. And then I think one of the things that we don't talk nearly enough about is maternal nutrition in this country, and maternal overweight and obesity is really something that it has a huge impact, of course, on a child's well-being and development, and mom, of course, herself. So we'll go to the next slide, and I'll drill down a little bit into kind of the U.S. picture. I know many of you, if not all of you, are very familiar with all of this landscape, with these statistics, but I just want to highlight a few statistics that we sort of found in putting together our report, The State of the First 1,000 Days, which we released about 2 years ago, and it was the first report that we were aware of, at least, that took a comprehensive view to try to marshal together all the evidence around maternal and child nutrition and sort of present a statistical snapshot of what that looked like, what the problem looked like, and really, more importantly, what the opportunities to address some of the challenges were. So I'm going to move quickly through the next few slides because I want to spend the bulk of our time talking about some of the solutions that we see and how we at 1,000 Days and and want to hear from all of you how you are tackling some of these statistics and problems yourselves. So starting in pregnancy, I sort of gave a nod to this already. About half of women are entering pregnancy overweight and obese in the U.S., and about half of them are gaining an excess amount of weight during pregnancy. And of course, this has an impact on mom's health and the health and well-being of her child. And this, in part, contributes to some of the high levels of maternal mortality and morbidity that we see here in the United States. And I'm sure, as many of you know, the United States has one of the highest rates of maternal mortality and morbidity of any developed country. And the problem of poor nutrition writ large and the problem of maternal mortality and morbidity really does fall hardest on low-income communities and communities of color. And so this, of course, is leading, before a child is even born, to a disproportional impact on children of color and children from low-income communities. So we really believe that there's a strong need to invest much more advocacy, energy, attention, funding in looking at what is happening in pregnancy and ensuring that moms have healthy and safe pregnancies. In infancy, which is the place that I think a lot of us work around breastfeeding, of course, we know the statistics. We have made incredible progress as a country in terms of moving our rates of breastfeeding initiation, in terms of the baby-friendly hospital initiative and how many baby-friendly hospitals we now have in the United States. But the reality is that the U.S. is still a very unfriendly place for moms, especially moms who want to breastfeed. And this takes many forms, and I don't need to tell all of you this, which is one of the reasons why we very much prioritize advocacy around paid parental leave as part of our work. We want to be able to break down as many of the barriers that women in this country experience around breastfeeding. Paid leave is only one of those barriers, and I'll talk a little bit about the other barriers. But of course, it's not just breastfeeding or low rates of breastfeeding that are part of the challenge in infancy. Increasingly, we're seeing children introduced to foods too early. And an excessive caloric intake in young babies, which is concerning. When we take a look at the diets of young children, of toddlers, it very much mirrors the American diet. Some of these statistics, whenever I show them, elicit a lot of surprise, but we really shouldn't be surprised because, young children, they're eating what we're eating, and in many ways, we know that the diets of Americans are too low in fruits and vegetables and too high in processed foods and sugar and unhealthy fats. But what is particularly concerning, I think, in this set of statistics is that 1 in 4 children between the ages of 1 and 2 aren't getting enough iron, and iron is a key nutrient that is needed for brain development. And so there's really a need to focus on measuring that and figuring out really a strategy for how we address that. So that leads me to kind of our agenda for change around the next 1,000 days, and we've broken this out in 4 categories: maternal diet and health, and I'm just going to touch on maybe 4 or 5 of them as is relevant for this group. The first one really is empowering parents with the understanding of why the first 1,000 days is so important, why nutrition is so important, and that they know what the best practices are on infant and young child feeding. And I'm very excited about this one. This one happened to be sort of #1 on our list when we put together the report. And as it happens, we have just launched this new exciting work in partnership with the CDC and Healthy Eating Research to put together a resource for parents and caregivers on infant and young child feeding. And what these are videos, short videos. They're very much geared to today's moms, today's caregivers. And it takes the expert-reviewed, evidence-based information on baby and toddler feeding, and it puts it into practical, accessible resources for parents that are busy, on the go, and just want to know the essentials and the basics. So far, we've put together a series of 12 videos, and these videos really range from topics from, is my baby ready to start eating solid foods? What should my baby drink? What should my baby avoid? How to cook baby's first meat. And so they're a combination of practical tips and how-tos. We're excited. We launched these videos maybe a few weeks ago. So far, we've gotten about 1 million views, combination of Facebook and YouTube, and we're promoting them on our social channels. And we've heard a lot of feedback from different partners that these videos are actually incredibly useful. So I invite you all to check them out, and please give us your feedback. Tell us what you think. Tell us if we've gotten anything wrong, and if you want, what you want to see more of. So that we're very thankful to the CDC and the Robert Wood Johnson Foundation for supporting that work. The other bit that was on 2 slides previous, and we don't have to go back, is we know that the dietary guidelines for pregnant women and children under 2 are under development, led by, I believe, USDA along with HHS, and they're slated to be released in 2020. And we're keeping tabs on the development of those dietary guidelines because, of course, it's the first time ever that the U.S. will have dietary guidelines for this population, and it's incredibly important that we get it right. It's incredibly important that the guidelines underscore the importance of breastfeeding and the importance of healthy, nutritious diets. So we're watching carefully to make sure that the process is, while being inclusive, absolutely relies on the best-in-class evidence in terms of what moms and babies need for a healthy first 1,000 days in terms of their nutrition. So please do get in touch if you're interested in learning more and getting involved in that work. The work around pregnancy and ensuring that moms have healthy pregnancies, sort of, I think for us, it came to a head when the Affordable Care Act and Medicaid and even the Children's Health Insurance Program sort of became targets in this political environment, and we really believe that Americans deserve and need access to comprehensive, affordable health care. Particularly, it's so important, as we've discussed, in the first 1,000 days for both mom and baby's health. So we've done a lot of work joining forces with a lot of other advocacy groups to really protect the benefits for moms, the prenatal, the comprehensive coverage of maternity and prenatal care benefits, obviously the coverage around breastfeeding, counseling, and supports and supplies, also critically important. And so we need to ensure that as many women in the United States as possible have access to those benefits under their health insurance. Next up, in terms of our agenda for change, and this is where these steps are really where the breastfeeding work that we do comes to life. I've talked a little bit about paid parental leave, but obviously it's not just about paid parental leave. We also need baby-friendly, family-friendly, mom-friendly workplace policies to ensure that moms have the time to either spend with their children or pumping milk and making sort of accommodations for breastfeeding moms as well as pregnant moms. We want to make sure that we create a more breastfeeding friendly society, and that takes shape in many ways. All the work that you all do, of course, reinforcing that, whether in healthcare facilities and communities, workplaces, and so very much supportive of that. And then the work that that I spend a lot of my time on is actually on number 8 in terms of thinking about the International Code of Marketing of Breast Milk Substitutes and how we get companies to comply with the code. Though the code, of course, is not enforced in any way through regulations or law here in the United States, we make the case to companies that they are under an ethical responsibility to market their products in an ethical manner, even in the United States. So companies police themselves and voluntarily make accommodations around complying with the code in many developing countries, and we ask that that same standard that they put into place themselves apply here in the United States as well. So we very strongly support the code, and we do a lot of advocacy to ensure that the code stays strong and relevant to all countries and all stakeholders. And then finally, and perhaps most importantly, we really take an equity view in our work, whether it's global or domestic, and we recognize that the most vulnerable communities in the U.S. and globally, especially those who are struggling economically, need the most help. And so we fight a lot to strengthen the programs that help low-income parents and low-income children, and we want to make sure that healthy diets, healthy foods are available and affordable for all families. So that is part and parcel of our work. I shared with you a little bit of the statistical overview, our sort of advocacy agenda, but this work around listening to America's mothers is work that we're really proud of, because at the end of the day, it doesn't matter if we are able to comb through the statistics and present the science and showcase sort of our advocacy agenda. What matters is the experience of mothers. And so this is work supported by the Packard Foundation to do qualitative research with low-income moms to understand the barriers that they were facing when it came to feeding themselves and feeding their young children. And we're really proud of this work. We put together a number of presentations and I think webinars, and then this report that showcases some of the stories and lifts up the voices of moms in this country, and let's listen to them and hear what they have to say. Now, turning our attention to World Breastfeeding Week, we at 1000 Days work very closely with UNICEF and WHO and many other partners as part of the Global Breastfeeding Collective. Last World Breastfeeding Week, we were proud to work with UNICEF and WHO and Live and Thrive, an NGO working in many different developing countries throughout the world on this investment case for breastfeeding. And this was making the case to finance ministers, sort of the economic decision makers in a country, around why they should be investing in promoting, protecting, and supporting breastfeeding. And we make the case in terms of dollars and cents, in terms of the costs of suboptimal breastfeeding, in terms of lives lost, lives saved, however you want to look at it, but also in terms of cognitive losses. So we really do emphasize the importance of breastfeeding as a critical way to improve a country's what's called an economics human capital. So this is where we make the brain development argument very, very strongly. And we launched this last World Breastfeeding Week, and we're excited to look ahead to this next Breastfeeding Week, and that is August 1st through August 7th of this year. And of course, we know there's a National Breastfeeding Month, and that's all of August. But the theme, as put together by the World Alliance for Breastfeeding Action, WABA, I actually don't know what that WABA stands for, I just realized, but WABA is breastfeeding is the foundation for life. So this very much, of course, fits in with our view. And let's see.
Did we lose the connection?
Yeah, we're getting a message that we've lost the connection, so I don't know if the organizers can chime in and let us know if you can still see the screen.
Yeah, we can see the screen, Lucy.
Wonderful.
And
thank you. Okay, wonderful.
Good.
Thank you. I'll keep moving on, and I just have just 2 more slides, and then I'm done, and I'll turn it over to you all to ask questions. But we at 1000 Days believe that World Breastfeeding Week and really and National Breastfeeding Month is a fantastic opportunity to, as we like to say, pump up the volume on breastfeeding, changing and reclaiming the narrative around breastfeeding, and making the world know that there's a community, a truly global community of support for breastfeeding, and making the case, of course, for why breastfeeding matters, and more importantly, why women need to be supported to breastfeed, because as we like to say, nobody breastfeeds alone. So we want to take advantage of World Breastfeeding Week, and we've put together a webinar series with one of our partners called Upswell. They work actually quite closely with Facebook and other social media channels, and so they're helping us make this available to advocates all over the world, and including here in the United States, to help folks learn how to use social media to get their messages out, And of course, we want to use World Breastfeeding Week to be talking about breastfeeding, to get our breastfeeding messages out. So there's a series of webinars you can see from the screen, each happening, in pretty short order over the next few weeks. And that's to sort of lay out what the opportunity is and why we think social media is such an important tool to use in our advocacy and in our promotion, how we develop content for social media. It is a little bit of a science and it's a little bit of an art form. And so we know that good content can go viral, can be shared, and can be consumed by the audiences that we're trying to reach. And so it's tips and tricks on how to create good content. Storytelling. If anything, breastfeeding, we have a plethora of stories from mothers, from caregivers, from healthcare practitioners, from you all, in terms of why breastfeeding matters, and the good, the bad, and the ugly of breastfeeding, because I think we have to be honest about some of the challenges that mothers encounter, in particular the barriers that they encounter around breastfeeding. So storytelling, why it matters, and how to do it well, and then finally, the webinar on sort of what we've got planned and what other partners have planned for World Breastfeeding Week. So we hope you all can join. I think we've sent out the information on how to register for the webinars, and we'll be sure to follow up with that information if you haven't already received it. And then finally, just a big thank you to all of you, because we really lean on the work that all of you are doing, the stories that you all share, the information that you all share. We are not a direct service organization, so we take we take a lot of the work and try to showcase it as really kind of best practices, gold standard, as examples of how people are helping mothers and babies succeed in this country. And so thank you for everything that you're doing, and we're really excited to be part of the USBC community. And with that, I will stop talking and turn it over to you all for questions and discussion.
Great. Thank you so much, Lucy. And yes, your screen did freeze up in the last bit, so I have your slide. I'm going to just show it to you, the webinars. The one with the webinar. So we didn't see the last one. But thank you for that terrific presentation to show us all of the great stuff that is happening, and just that. Can you see my screen?
Not yet.
Yes, Kenny, I can see your screen.
Okay, I think it might be then a network connection at your end. Lucy. So I just wanted to make sure that our audience saw this. So then the Global Breastfeeding Webinar Series, the first one, like you said, is on June 21st, and the link was sent, the promotion was sent in the Weekly Wire last week, but we will also be including it in our social media, and we'll be posting the recording. So this is the schedule, if you can see, of the Global Breastfeeding Series. So that's very exciting, just in time for National Breastfeeding Month and World Breastfeeding Week. So as you can see, with the agenda for change that you have, we have a bunch of questions. There's so many overlapping things that we all, our common mission in all that we do. We see folks asking for links to, the links to the new resource on Healthy, the 12 videos. We'll post that for sure. That's also included in the slides. The link for dietary guidelines. Let me see. Okay, here's a question about, given the vantage that you all have, the 1,000 days team has with working internationally, in terms of some of the core issues of formula marketing or others, how could some of your advocacy from other nations, how could we learn from other countries too? Because often in breast, not so much in formula marketing, but also in creating breastfeeding friendly communities, just creating where making breastfeeding the norm. How might some examples from international, your work internationally, be applied in the US context?
Yeah, that's a great question, and I think it's exactly that in terms of making breastfeeding the norm. We learn so much about different country contexts and different cultural contexts, having this global vantage point, and I think we bring that perspective into our work in the U.S. Because we can't make assumptions that just because everyone hears the messages that they should be breastfeeding their baby, that they actually can put that into practice. In different country contexts, it's interesting because different members of the family or the community play really important roles. So mothers-in-law, for example, in India and other parts of South Asia, play a really important role in how their daughters-in-laws, how the mothers feed their babies, and what rituals and what practices they follow. In other places, actually the tribal chiefs have a say in sort of the customs and practices around feeding the babies and how mothers and babies relate to each other. So I think we can't take for granted all the people in a woman's life that either act as an enabler or a barrier to successful breastfeeding. So I think that's one big lesson. The other lesson is that, and this does relate to the formula marketing, the formula marketing in these countries is pretty intense, and it didn't used to be that way. And so women are starting to really question, they're starting to see formula as, well, it must be better because look at, this beautiful marketing and these beautiful pictures of chubby babies, and I want that. And so marketing really does have an impact on perceptions. It has an impact on, what women consider, desirable. And I think we probably take it a little bit for granted here that marketing does have, an impact on our choices and on our preferences and what we see as ideal or not. And so I think that trying to see marketing through the eyes of somebody who perhaps is being, marketed to in this way for the first time, I think kind of gives us a fresh perspective that we can also bring into the U.S. context, where we're, quite frankly, surrounded by marketing for all kinds of products all the time.
Absolutely. Thank you, Lucy. And again, in terms of the agenda for change, so many things, like you said, breastfeeding doesn't, exist either. Exclusivity or duration doesn't exist in a vacuum, and being able to make sure that our partners who are working on preconception, intraconception work, the infant and toddler diets, and all of the support that's needed for families to be able to do that is so very essential. So we have, could you tell us a little bit more about, the work in the research and some of your work in terms of access to comprehensive, affordable, culturally congruent healthcare? Some more details about that?
Sure. The research that we've done, we've done a couple different bits and pieces of research, but the one I mentioned, of course, was the qualitative research. So we did two types of qualitative research, interviews and ethnographies. And that ethnographies is, it's a word I learned not too long ago, but it really is to try to take a more intimate look at what's happening in sort of a mother's life, and in the case of our research, and that was, going into their homes and going on shopping trips with them, looking in their refrigerators. And so it was really to try to get a much more in-depth understanding of what barriers really women were facing in terms of giving their kids, healthy, nutritious foods and feeding themselves and their families. We've done some survey work, and some of the survey work that we did was around the information that moms, the parents were getting around what to feed your baby, and we found that about half of the mothers that we surveyed were getting mixed messages. These mixed messages, they heard one thing from their pediatrician, they heard another thing from the WIC counselor, they heard something else from their Facebook group, and then they Googled it and they, found something completely different. And in that survey, the results of that survey were extremely consistent with the results of the qualitative research that we had done, that, women were getting information from a variety of sources, number one, and sometimes those sources conflicted. So, the work that we did with CDC and healthy eating research was to try to put sort of, some more, authoritative content, not authoritative content, but authoritative, perspectives on, what to feed your child, expert reviewed in a way that, is accessible, as I said. In terms of the healthcare fight, I think, many of you know that for some time, I think last year, there was discussion about whether, maternity care, prenatal care and childbirth, the maternity benefit was to be considered a part of the essential health benefits under the Affordable Care Act, and there's been attempts to gut the essential health benefits or weaken them. Same thing with the provisions for breastfeeding support and supplies. So that is critical, because we know that without that prenatal care, without the coverage, women are much more likely to have complications during pregnancy, preterm birth, low birth weight, which of course then has ramifications for that child later on in life. And so we're really trying to make, the case that this is just about, it's about women's health 100%, but it's also about the future health and well-being of the child, and that there's a cost implication, because we know preterm birth and low birth weight babies, have higher healthcare needs and therefore cost the healthcare system more. And so it's about focusing on healthy pregnancies and that healthy first 1,000 days to avoid those costs. And so depending on, the whims of Congress or the administration, we don't know kind of what lines of attack might be coming in terms of, weakening the protections for maternity care and breastfeeding benefits.
Absolutely. And we've all been very, very active in these in the year and months, especially with the perceived issues. And as you said, that there are just so many different areas for the change agenda. It's paid leave, it's access to healthcare, it's education of our medical and healthcare providers. And so do check out the 1000 Days website, subscribe to so that you can get to know that. Join the USBC learning communities. For most of us, for all of these areas, we have learning communities where we curate and bring resources from our partner organization. We develop, USBC develops a lot of the resources as well. So whether it's the dietary guidelines, you check out USBC's policy and advocacy toolkit as well. And we will put these into our into the resource. So we are getting questions about your reports, Lucy, the Listening to America's Mothers, the others. We will chat you the links or have a page when we put up the recording with all of these links that you can directly go to as well.
Thank you for that, and thank you for the interest.
Absolutely. Go ahead, Lucy.
I was just going to make one final comment. I mean, I know the agenda for change seems big, and we all sort of may be working on different pieces of it, and there might be other things that weren't on that list that you all are working on, which are incredibly important. But let's not, I think, in this climate where we might be feeling like we have to defend some of the gains that we've made over the last few years, let's not forget to imagine a country and even a world, quite frankly, that that does support women, that supports women to have healthy pregnancies and healthy babies and nourish their families. And let's imagine that world, and let's work towards that world, and try to just remember that that we've got a lot of folks counting on us.
Absolutely. And one of the questions here again says, how do we stress that often food preferences and food habits of our infants are being built, often without sharing the food habits of mothers and families, because so often it's acculturation, so often it's the early introduction of sugar-sweetened beverages and all of the other things that are kind of a combination of food insecurity. And so these are, as we work towards our agenda to make sure that we are being culturally relevant in the work that we do with educating our health professionals as well as our physicians as well. We had a session on breastfeeding in the South Asian community, South Asian Asian Pacific Islander community, and exactly as you said, the agency of the mothers-in-law or other family members are so important. So sometimes when we talk about the mother-baby dyad in the US context, we forget our population groups, that other members of the family, fathers, grandmothers, others have such a say in what how baby is fed, and all of the infant feeding and maternal feeding practices as well.
Yeah, absolutely. And yeah, the role of diets and cultural preferences in diets is something that we can't overlook. And in fact, we want to preserve and encourage in many cases. So
great. Monica Esparza asks, how do you engage pediatricians who continue to push for introduction of solids as early as 4 months? And I guess the education is ongoing. And
yes, I think that's why this work with CDC, our work with CDC is very parent-facing, but I know that CDC is also working with the American Academy of Pediatrics on sort of a similar kind of sort of training or having resources available on infant and toddler feeding, because there's a lot of misconceptions and perhaps not evidence-based information and practices that are being shared even in the medical community. I mean, the reality is that we probably don't spend enough time talking about nutrition in medical schools or in curricula for healthcare professionals. And so I think there's a knowledge gap, perhaps, a skills gap, perhaps. I'm not sure. I'm not a pediatrician myself, so I can't speak to that, but there is work to try to change that. It's also why I think the dietary guidelines are important, because that way we can, hopefully be singing from the same song sheet, and hopefully that song sheet will be a good song, right? It will be a song that is based in evidence and research and free of I think industry influences, which we're quite concerned about. So that, I think, getting everybody on the same page about when to introduce solid foods and what solid foods are good to be introduced will be very, very helpful. Absolutely. Because parents, I think, ultimately are not being well served by the confusing and conflicting information they're getting.
Mm-hmm. Thank you, Lucy. And CDC has been supporting so many of these efforts nationwide. Right now, the American Academy of Pediatrics is spearheading, along with a really diverse group of physician and nurse stakeholders, on education for physicians, nurses, and nursing. You think of education in the undergraduate level, at graduate level, and at as continuing education for practitioners, and then working with the levers for change, because sometimes if it's not on the exam, folks don't tend to study for it, or it's not included in the curriculum. So it's so important to be making sure that breastfeeding and lactation is included in different aspects of curriculum, whether it's physiology, immunology, and included. So the AAP has this stakeholder group, the Physician Education Constellation, has come up with a really good report. Again, if any of our staff can chat that link for the AAP into the box, that would be good. But if not, we will have a page with all of the resources that we mentioned at today's session. Again, thank you so much, Lucy. There's so much more we could talk about of the work that is ahead, and the dietary guidelines especially. This is the first time. So folks, watch out for alerts that come from 1000 days, that comes from USBC and our partners, because when there are periods of time when public comment is needed to engage, we will mobilize, and we hope that these guidelines, when they come out for the first time of a pregnancy through age 24, are robust and based on scientific evidence and free from, industry bias. So we have work ahead cut out for us in the coming months. Great. Again, thank you so much, Lucy, and 2000 Days. I'm going to do a very quick USBC announcement. So again, our National Breastfeeding Coalition's conference is going to be August 3rd through 5th in Atlanta. So the conference days are 4th and 5th, but we will be starting the regional meetings and the community building on the evening of the 3rd, after the membership meeting, USBC's membership meeting is. So thanks for everybody who submitted a proposal for consideration, and the panel presentations. Our reviewers are hard at work, and we will be sending out the notifications in the middle of next week. And this program is turning out to be our best yet. We have a combination of whole group learning. We have a lot of different spaces for peer sharing as well. So apart from the breakout sessions, we'll have regional meetings and identity caucus spaces. We'll have poster sessions, and also breakfast table discussions. We have an open mic night. So just many different spaces to build community, to learn from each other and network. So if you want to be, coming in and discussing the work that you do, wanting to make connections, we are still taking applications for table discussions or posters. So keep those coming, folks. And then be connected with us. Don't forget to register for the Global Breastfeeding Webinar Series. We'll be sending you the reminders for that again. And thank you to Lucy. Thank you to the 1000 Day's team, and thanks to you all for all that you do in improving maternal, infant, and child health throughout our country. So we hope very much that this session will spur ideas for action. And please be sure to complete the webinar evaluation and let us know how we are doing. We do read the evaluations, and your suggestions help us design future sessions that are most relevant to you. So you also get a certificate of attendance when you complete the evaluation. So thanks again. Goodbye for now, and I look forward to having you all on our next webinar.